If you really think about how we navigate the modern world, there is this underlying expectation of just instant gratification.
Oh, absolutely. We treat everything like a machine.
Right. You flip a switch, the lights come on, you press a button on your phone, and food shows up at your door. We are so conditioned to this instant mechanical response that we've somehow mapped it onto human biology.
Yeah, and specifically, we've mapped it onto human sexuality.
Exactly. We expect the human body to operate like a well-oiled machine on a movie set, complete with, instant, unlimited natural lubrication the second an encounter begins.
It is a pervasive expectation, but a completely unrealistic one. I mean, we treat our bodies like they have a simple binary setting, just on or off, ready or not ready.
Like a light switch.
Right. But human biology, especially when we're talking about arousal, operates as a complex ecosystem. It's not a simple machine with a power button.
And that ecosystem is exactly what we are going to explore with you today. In this deep dive, we are pulling from a really fascinating stack of sources to figure out how all this actually works.
We got a lot of ground to cover.
We really do. We have clinical studies from the UT Austin Psychology Labs, data from gynecological research organizations, surveys on sexual health from companies like HANX, and some really comprehensive medical breakdowns from UB Health and Evie.
And we aren't just going to list off facts today.
No, definitely not. We are looking at a very specific question. Basically, how do unrealistic societal and media depictions of constant, excessive female lubrication severely distort our expectations of our own normal anatomy?
That is the core issue right there.
So,
Because understanding the actual physiological mechanisms at play, like the why and the how behind our biology, is the ultimate shortcut to better well-being.
yeah, it really takes the pressure off.
It does. When you understand how the system is actually designed to work, you stop blaming yourself when your body doesn't behave like a, highly edited film.
So let's start with that film comparison. If you look at mainstream media, romance novels, or pornography, the portrayal of the vagina is basically a biological fiction.
It's completely exaggerated.
It is. It's always perfectly ready, and it instantly produces this endless amount of moisture without any warm-up whatsoever. I mean, no one on screen ever stops to grab a bottle of lube. It just seems to happen by magic.
The media presents this idea of instant readiness, but the anatomical facts tell a very, very different story. Vaginal lubrication is not a conscious choice.
Right.
You cannot simply will it to happen any more than you can consciously force your pupils to dilate or force yourself to blush on command.
Which is such a wild thing to think about because we put so much pressure on it.
We do,
Yeah.
but it's a complex physiological response that fundamentally requires your parasympathetic nervous system to take the wheel.
Okay, let's break that down for a second because the nervous system has a few different modes. The parasympathetic system, that's the rest and digest mode, right? The complete opposite of the fight or flight response.
That's a great way to describe it. Your autonomic nervous system is essentially a seesaw.
Oh.
On one side, you have the sympathetic nervous system, which is your fight or flight response.
Okay.
If your brain senses any kind of threat, pressure, or anxiety, this system activates to keep you safe. It pumps adrenaline and redirects blood flow away from non-essential functions and straight into your large muscles so you can run or fight.
I'm guessing arousal is considered a non-essential function when you're running from a bear.
Exactly. Or even when you are stressed about work or when you're just experiencing performance anxiety in the bedroom.
Oh, wow. So just being anxious about performance shuts it down.
Yes, the fight or flight response actively blocks physical arousal. But on the other side of that seesaw is the parasympathetic system. When you feel safe, relaxed, and comfortable, this system takes over. And that is the absolute biological prerequisite for lubrication to even begin.
So if someone is completely relaxed and the parasympathetic system is activated, how does the biological process actually work? Where does the moisture come from if there isn't some hidden reservoir?
The mechanism is called vaginal transudation.
Transudation, okay.
Right. When your parasympathetic nervous system gets the green light, it triggers a massive increase in blood flow to the pelvic area. We call this vasocongestion.
Vasocongestion. Got it.
So blood pools in the dense network of blood vessels surrounding the vagina, causing the vaginal walls to swell.
So it's essentially a localized change in blood pressure.
Yes. And as that blood pools, the pressure inside those vessels builds up. That pressure eventually forces a clear, plasma-like fluid to literally seep through the walls of the vaginal blood vessels and onto the surface of the vaginal tissue.
It sounds a bit like how a porous hose works in a garden. You turn on the water pressure and the moisture just beads up and seeps through the material.
That is a highly accurate visualization, actually. It's a whole body process governed by fluid dynamics, vascular pressure, and nerve signals. It requires the physical movement of blood into the area to create the pressure needed for the fluid to transudate or seep through the tissue.
Well, if it requires all of that physical routing of blood and building of pressure, that can't possibly happen instantly. I mean, expecting instant lubrication is like expecting a car to go from 0 to 60 without even turning the engine on.
That's a great analogy, and you're right, it doesn't happen instantly. Clinically speaking, this whole body process typically requires 10 to 20 minutes of sustained arousal for the blood flow and the safety signals in the brain to fully align and produce noticeable lubrication.
Wait, 10 to 20 minutes?
Yeah, typically 10 to 20 minutes.
That is a massive disconnect from what we expect. I mean, 20 minutes is an eternity compared to a 5-second transition in a movie. Are you saying the body is literally incapable of doing it faster?
While there is always biological variation from person to person, yes, the architectural reality of the vascular system means it takes time for blood to pool and for pressure to build.
Wow.
You just can't bypass the physical laws of how fluid moves through tissue.
If the body genuinely takes 10 to 20 minutes to physically catch up, that raises a really fascinating psychological question. What happens when your mind is completely ready, like you're highly attracted to your partner, you are fully in the moment, but your body is still at, minute 3 of a 20-minute process?
What you are describing is a scientifically documented reality known as arousal non-concordance.
Arousal non-concordance. I really want to dig into this because it feels like a paradigm shift for how we understand desire.
It is a crucial concept to understand. Arousal non-concordance simply means that your mental desire and your physiological response do not always match.
Okay.
They are controlled by overlapping but ultimately separate systems in the body. You can be incredibly turned on mentally but remain physically dry.
And I imagine the reverse is also true. Like you could experience physical lubrication without actually wanting to be in a sexual situation.
Yes, absolutely. Your body can react to a sexually relevant stimulus with physical lubrication, even if you have zero subjective mental desire. It's an automatic physiological reflex, responding to friction or stimulation, completely separate from your emotional state.
To really illustrate how deeply this disconnect affects people, we have to look at that study from the UT Austin psychology labs. I was absolutely blown away by this when I read it in our sources. They wanted to objectively measure vaginal lubrication in women, which is historically a very difficult thing to quantify in a lab setting.
It is notoriously difficult to measure objectively. To solve this, the researchers at UT Austin got incredibly creative. They decided to use Schirmer tear test strips.
Okay, and what are those exactly?
For context, these are small strips of specialized paper ruled in exact millimeters that are FDA approved and normally used by optometrists to measure tear production in patients who suffer from dry eyes.
Wait, so they took these tiny paper rulers meant for eyeballs to measure vaginal moisture?
Exactly.
How did they actually set up the experiment?
Well, they recruited 64 women for the study. They split them into 2 groups. Half of the women reported having sexual arousal concerns, meaning they came into the clinic struggling with feeling dry or feeling like they couldn't get physically aroused.
Okay, and the other half?
The other half was a healthy control group with no concerns. The researchers attached these eye drop test strips to wooden applicators, inserted them slightly, and had all the women watch a sexual film. They measured the exact millimeter of moisture produced before and after the film.
And the physical results were what made this such a landmark study, right?
Correct. When they looked at the objective paper strips, both groups showed a significant increase in physical lubrication. But here is the critical finding. There was absolutely no physiological difference in the amount of lubrication produced between the women with sexual arousal concerns and the women in the healthy control group.
Wait, let me pause on that. The women who came into the clinic believing their bodies were broken, believing they had a dysfunction, were producing the exact same amount of moisture down to the millimeter as the women who felt completely fine.
Yes. Their bodies were performing identically. But here is where the distortion of expectation comes in. After the film, the researchers asked the women to self-report how aroused and how lubricated they felt.
And I'm guessing they didn't report feeling the same.
No. The women in the arousal concern group reported experiencing significantly less lubrication than the healthy control group, despite the paper strips proving their bodies were functioning perfectly.
So their perception of their own bodies was completely warped. If their bodies are doing the exact same thing physically, why the massive disconnect in how they felt about it?
We can understand this through a framework developed by a clinical psychologist named David Barlow. It's often referred to as Barlow's model of sexual dysfunction. He studied how anxiety interferes with sexual performance. According to this model, people develop a script in their heads of what a normal response should look like. A script overwhelmingly written by exaggerated media tropes where you were supposed to be instantly, effortlessly soaking wet.
So they expect this geyser-like flood of moisture.
Yes. And when their normal biological transudation process begins, which is subtle and takes time, remember, it doesn't match the extreme expectation in their head.
Right.
This causes cognitive interference. Instead of staying in the moment, they start spectatoring, essentially stepping outside of themselves to monitor and judge their own physical response.
And I'm guessing that judgment immediately triggers the sympathetic nervous system we talked about earlier.
That's the tragic feedback loop. The anxiety about not being wet enough signals a threat to the brain. The fight-or-flight system kicks in, and it actively shuts down the parasympathetic system, physically halting the blood flow required to produce the wetness.
Wow.
Their expectation of failure physically causes the failure.
It's a self-fulfilling prophecy driven entirely by a false media narrative.
Exactly.
But if the brain and the body are on two totally different tracks, and the body can react physically while the mind is in a state of anxiety or even terror, what happens when this non-concordance plays out in a non-consensual situation? Because this isn't just about performance anxiety and a healthy relationship.
No, it's not, and that is a very serious and important application of this science. We have to look at a highly damaging misconception that exists in our society and our legal systems. There is a pervasive idea that if a victim experiences vaginal lubrication or even an orgasm during a sexual assault, it somehow implies that they consented or that their body was signaling enjoyment.
It is a devastating assumption that survivors have to face. How does medical science explain what is actually happening in those moments?
Science dismantles this assumption entirely through something called the preparation hypothesis.
The preparation hypothesis.
Biologically, vaginal lubrication can trigger as an involuntary protective reflex. When the body is subjected to a sexually relevant stimulus, even a violent or non-consensual one, the autonomic nervous system recognizes that friction is occurring.
Right.
So to prevent severe tissue damage, tearing, and trauma to the vaginal walls, the body automatically initiates transudation to lubricate the area.
So the body is just trying to mitigate physical damage. It's an evolutionary defense mechanism. Like if you get dust in your eye waters to flush it out. You didn't consent to having dust in your eye and you aren't enjoying it. Your body is just deploying a reflex to protect the tissue.
That is the perfect way to look at it. Just like a doctor tapping your knee with a hammer causes your leg to kick, or how your palms sweat when you're standing near the edge of a cliff. You aren't consenting to the fear of falling. Your autonomic nervous system is just reacting. Treating the body's involuntary physical reflexes as a lie detector for a person's emotional state or intent is fundamentally flawed. Arousal non-concordance proves that physical wetness does not equal emotional desire or consent.
That is incredibly clarifying and such an important distinction to understand. Now, building on this idea of how we misunderstand fluids and physical responses, we should probably address the ultimate media distortion of female moisture. I'm talking about squirting.
Yes, the phenomenon of female ejaculation and squirting is perhaps the most heavily distorted physical response in popular media today.
If you look at pop culture, it is depicted as this massive release of fluid. It's presented almost as a required party trick for sexually liberated people or some like ultimate high score you have to unlock to prove you are doing things right.
Right.
What are the actual medical facts here? Is it as universal as the internet makes it seem?
It is absolutely not universal. Squirting is a documented, real physiological response, but clinical research suggests that only anywhere from 10% to 50% of women may ever experience it.
Okay, wow.
That means up to half of the population will never experience this, and that is perfectly normal.
There has been so much debate about what this fluid actually is. The UK pornography industry even temporarily banned the depiction of it back in 2014 because regulators argued it was just urine. What does the chemical analysis actually show?
The fluid is complex. Studies utilizing ultrasound imaging and chemical analysis have shown that the fluid expelled during a high-volume squirting event originates predominantly from the bladder. It does contain diluted urine, but it is mixed with secretions from the Skene's glands.
The Skene's glands, what are those?
The Skene's glands are small structures located near the urethra. They are often referred to as the female prostate because they are biologically homologous to the male prostate gland. In fact, they produce prostate-specific antigen, or PSA, which is found in male semen.
Really? What is the biological purpose of these glands? Why do they exist if squirting isn't a universal function?
Their primary evolutionary function is believed to be protective. The fluid they produce contains antimicrobial properties that help protect the urinary tract and urethra from infection.
Oh, that makes sense.
During sexual arousal, these glands can swell and produce a small amount of thick, milky fluid. That specific small release is technically classified as female ejaculation.
So how does that small release turn into the high-volume squirting we hear about?
Well, during intense arousal or orgasm, the bladder can fill, and the intense muscle contractions can cause an involuntary release of that larger volume of fluid from the bladder, which picks up the skin's gland secretions on the way out.
So expecting every single person's body to do this is like expecting everyone to be able to roll their tongue or bend their thumb backward. It's an anatomical variation, not a standard feature.
Exactly.
But because it looks so dramatic on camera, media has elevated it into a standard of performance.
And that elevation creates immense pressure. It creates a hierarchy of sexual response based on highly edited adult films. People feel inadequate if their unique anatomy doesn't perform this specific variation, which just demonstrates a fundamental misunderstanding of biological diversity.
Which naturally leads us to the collateral damage of all these myths. How do these unrealistic expectations impact the everyday decisions people make about their own bodies? Let's talk about something as basic as personal lubricant.
The stigma surrounding artificial lubricant is a direct consequence of the self-lubricating machine myth. If you believe the body should instantly produce all the moisture it needs, then reaching for a bottle of lube feels like an admission of failure.
Our sources included a survey conducted by the sexual wellness company, HNX. They surveyed over 5,140 people, and the results really highlight this stigma.
The data is very telling. They found that a staggering 76% of respondents directly associated physical wetness with emotional arousal.
76%.
Because of this false association, people wrongly assume that needing lube means they are not attracted to their partner, or that their partner isn't attractive enough to them.
Or they associate it with getting older or having a medical condition, instead of just viewing it as a normal, helpful tool. I mean, if you think about it, we wear sunglasses when the sun is too bright. We use lotion when the winter air dries out our skin. But if you reach for lube, suddenly you have a dysfunctional relationship.
It's completely counterproductive, especially when you look at the numerous everyday factors that naturally reduce a person's baseline lubrication.
What kind of factors?
Common medications are a major one. Antihistamines, for example, are designed to dry up mucous membranes in your nose to stop allergies, but they work systemically, meaning they dry up mucous membranes everywhere in the body, including the vagina.
Oh, I hadn't even thought of that.
Hormonal birth control alters the estrogen levels needed for tissue elasticity and moisture. Antidepressants, everyday stress, and normal variations in the menstrual cycle all impact fluid production. Lubricant is widely recommended by healthcare providers as a basic first-line support, yet people avoid it because of media-driven shame.
And this distortion isn't just limited to how the body functions or how wet it gets. It heavily distorts expectations of how the body is supposed to actually look. If you only ever see highly curated, airbrushed, or surgically altered anatomy on a screen, you start to believe that is the biological default.
This brings us to a deeply concerning trend that has been heavily monitored by gynecological organizations, such as BRITSPAG, the British Society for Pediatric and Adolescent Gynecology. They are seeing a massive increase in teenagers and adult women seeking cosmetic labiaplasty.
Labiaplasty being a surgical procedure to alter or reduce the size of the labia.
Correct. People are seeking surgical intervention for anatomy that is completely normal and healthy. The pervasive false image of a smooth, tucked-in, uniform vulva has convinced them that their natural variations are deformities. Many people, including partners whose expectations are entirely shaped by pornography, simply do not understand the mechanics of puberty.
So why do labia naturally look so different from person to person? What is the biological mechanism there?
We come down hormones. During puberty, the body experiences a surge in female hormones, particularly estrogen. The labia minora contain estrogen receptors. When those receptors are activated during puberty, the tissue naturally expands, grows, and often develops darker pigmentation.
Right.
This growth is asymmetrical more often than not, leading to folds, differing lengths, and wide variations in color. It is supposed to look like that. It is the visible evidence of normal hormonal development.
When you step back and look at it, you have people undergoing actual surgical procedures, taking on all the risks of anesthesia and altered nerve sensation to fix a body part that is functioning perfectly. And they are doing it just because it doesn't match an artificial airbrushed image on a glowing screen.
It is the ultimate manifestation of how media expectations distort our physical reality. When you are kept in the dark about what normal biological variation looks like, whether that's the shape of the tissue, the 20 minutes it takes to lubricate, or the occurrence of arousal non-concordance, you end up pathologizing your own healthy body.
Okay, let's bring this all together. If you take away anything from this deep dive into our sources, let it be this. Your body is an ecosystem, it is not a machine. Arousal takes time, often 10 to 20 minutes for blood flow and pressure to do their job. Your mental desire and your physical wetness do not always match, and that is a perfectly normal phenomenon called arousal non-concordance. Using lube is a completely normal, healthy tool, not a sign of failure. And the media's depiction of female anatomy, both in form and function, is largely a biological fiction.
I would leave you with this final thought to mull over as you go about your week. If we truly internalize that our physical sexual responses, like transudation or vascular engorgement, are largely involuntary biological reflexes governed by fluid dynamics in the nervous system, how might that change the way we communicate with our partners?
Oh, that's a great point.
If we stop treating our bodies and our partners' bodies as biological lie detectors for our emotions, could we actually unlock a much deeper, more honest level of intimacy?
That is a phenomenal question to end on. Instead of looking at your body as a machine that is failing to turn on, you can actually learn to communicate about what the ecosystem needs in the moment. Thank you so much for joining us on this deep dive. Keep questioning the expectations you see on screen, keep talking honestly with your partners, and keep learning about the amazing, beautifully complex reality of human biology.